Without further ado, I'm going to hand over to our President, Dean Royles, who's going to make the opening remarks. So thank you and good morning, Dean.
Morning, Annesley. Thank you for that introduction and welcome everyone. Hello, my name's Dean. I just thought before I kicked off with my opening speech that it would be great just to understand something about the people that we've got with us this morning. I know loads of you are joining, and it would be great to encourage people to be using the chat function. So perhaps we can find out who's the longest serving person in the NHS that we've got. So if you've got more than, let's say, I don't know, 20 years or 25 years, perhaps say hello in the chat room and see how long we've got people been working here. Or maybe you're just completely new to this profession, new to this sector, new to the NHS. Just say hello in the chat room, and then we can sort of see some of the sort of people that we've got joining us this morning, because it's great to have such a wide range of people here. I'm going to make a start. Please do use that chat function. It's a really great way to network with people and sort of democratize these conference events so that everyone's got a view and a voice. Really important that we can hear what it is that you've got to say. And it's a real privilege to be opening our annual conference once again. And what a year it's been. I can't begin to express how proud I am to be president at this time. You, our members, have been truly remarkable, bringing all your skill, your experience, your knowledge and your influence to help the NHS navigate its greatest ever challenge. And I know that you're humble, working behind the scenes, unseen but essential, keeping our staff safe and vaccinated and ensuring that they've been deployed, supported and valued as they've gone over and above what anyone could have reasonably expected. You have deployed and redeployed people, introduced massive health and well-being programs, attended bronze, silver and gold meetings, sometimes all on the same day. You've worked with trade unions in partnership to introduce new policies, procedures and protocols. You've rolled out vaccination programs. You've set up, stood down and set back up again vaccination hubs. You've developed, introduced, reviewed and refined risk assessments and provided more data, spreadsheets, templates and intelligence than you've ever imagined possible. And I could go on and on and on. Someone said to me, it's like being involved in a massive pie eating competition where the first prize is more pie. And almost 2 years on, you're still on your feet, exhausted, but still committed. Truly has been remarkable and inspiring. And I know that the challenge hasn't just been an organizational one. It's been personal, very personal. Many of you have carried on despite the personal impact COVID has had on you and your families, on juggling household illness, children and family isolation, as well as the sadness and grief from the loss of loved ones that were taken too soon. And I know that a thank you at a virtual conference can't begin to express the appreciation that I and so many others feel, but I would like to express my heartfelt thanks for all you have done. Thank you so very much. And despite this, you've also ensured that the day job has continued, recruiting, training and developing thousands and thousands of staff, online inductions and onboarding. You've initiated OD programs, processed pay awards, sickness absence reviews and more. What you do day in, day out has never been more important, more high profile and more appreciated. And I wish I could tell you that it was all over, but we know it isn't. We know it isn't. And we now face a winter like no other. We face a winter like no other, with increased demand on secondary, primary and on social care, managing backlogs, leading a tired and a stretched workforce, introducing vaccination booster programs and the prospect of managing mandatory vaccinations for staff. Respiratory illness and snow, yes, snow will be with us. And of course, we still got continued high levels of infection and the spectre of new variants like Omicron. I don't think I said that sinister enough at this time, like Omicron. It truly is a winter like no other. And I know you can see the light at the end of the tunnel. And we've learned so much over the past year, haven't we? We know the difference that we can make. You can see and feel our added value. You've been tested in a very public arena and you've not been found wanting. You should really be incredibly proud of your personal and your collective contributions. Vince Lombardi, the former American football coach, said, "The measure of who we are is what we do with what we have." The measure of who we are is what we do with what we have. And he was right. And on that measure, you're all absolute giants. As the HPMA, we will do all we can to champion what you do, to make your voice and your views heard, and to support you whenever and wherever we can. We do have some fantastic events coming up, leading up to our All Being Well in-person annual conference next year. So please do keep an eye on our website and ensure you receive our regular email updates. These events are run by our branches throughout the UK, in Scotland, in Wales, in Northern Ireland, and in England. And they're a great way to learn, to share, and to network. It's fantastic to see so many delegates from all those countries here today. So thank you for taking the time to come along. Moving away from COVID, it's also been a year that's seen massive changes in the nature of work and in the workplace as organisations have responded to a changing labour market and introducing more hybrid and agile working. The world of work has changed and there is no going back. There is no going back. It will take all our skill, our experience, to establish a new workplace norm where agile working is the mainstay of what we do. And I'm looking forward to chairing a session on that a bit later on today. But this mainstay of agile working isn't just for corporate functions, but it's in clinical services too. I can remember as a HR director before the pandemic that we used to debate if consultants could do their SPA time, their learning time at home. How times have changed. Now clinical services are being delivered remotely from home. And I know that that's going to continue. Despite the national debate about face-to-face appointment, those changes are here to stay too. And we've also seen massive societal changes over the last year or so, with movements like Black Lives Matter following the murder of George Floyd. And we've also seen an increased focus on violence against women following the murder of Sarah Everard. This has featured heavily in the media and in our conversations as we've tried to develop our understanding and to deepen our awareness. And what we all know, if we work in HR, that these societal changes affect the workplace. We know that these new norms impact upon the workplace, affecting our leadership, our culture, our policies, and our procedures. Equality, diversity, and inclusion is at the core of great people management. And it's been inspiring over this last year to see the impact that people like Cheryl Samuels have had with the work that she's done around #InclusiveHR. Please just check that out if you haven't already done so. This is an agenda that's becoming ever more important and increasingly complex as we encounter conflicts in different views in concepts like privilege, the rights of trans colleagues who have fought so hard for recognition, and those of sex-based rights, between gender and between religion, and in areas like disability and neurodiversity. It can feel uncomfortable for many, and I know it can feel easier to take a step back and to be silent, but EDI is core to what we do, and it's core of who we are. It's a space that we must confidently occupy, In fact, it's our duty to immerse ourselves in this debate, to challenge ourselves, and to continue learning and developing, enhancing our knowledge and understanding. And there are practical things that we can do in our own departments. We can run the data of the people in our departments. We can analyse it. We can intentionally set out to understand the lived experiences of those that we work with, to co-design solutions, and then to evaluate them. And when they work, to shout about them. There's so much good practice in this area that we can share. As the HPMA will be ensuring a wide diversity of providers we use at our branch events and conferences. Good leadership requires us to surround ourselves with people with diverse perspectives who can disagree with us without fear or favour. Good leadership requires us to surround ourselves with people from diverse perspectives who can disagree with us without fear. And I know that Prerna will be talking later on about HR and the OD Futures Report and the opportunity that will present for us. Rujan will also be highlighting the CIPD HR profession map and making EDI a core as well as a specialist skill. And the HPMA is pleased to be adding our input into those essential areas as we develop the healthcare people profession over the next decade. This is an exciting time for our profession, and it has been fantastic to see colleagues in our organisations, working in our systems, working in our regions and nationally, all working as one team, delivering for patients and for service users. This really is a remarkable time for our profession, where the nature of work, the nature of the workplace, and the nature of the workforce are all changing rapidly. Almost daily, we can see it perceptibly. Artificial intelligence, machine learning, augmentation, robotics are no longer the domain of science fiction. They're with us now, and they're changing and improving daily. We're also seeing massive generational changes in the policy landscape with the Health and Care Bill, in social care and in integrated care systems. And the Department of Health has also announced a review into NHS leadership by the retired Vice Chief of the Defence Staff, Sir Gordon Messenger. You and your colleagues have led your organisations and the country through one of the most significant challenges in generations, and I've seen and heard numerous examples of amazing leadership practice. It's in our nature as HR and OD professionals to always want to learn, to improve, and as we move to more system and integrated ways of working, it's right that we understand new skills and new approaches. But I would really urge the review to look at how this profession, this people profession, has behaved and led over the last couple of years, with care and with compassion, with true humility and in partnership. It really has been servant leadership at its very best. It has been the best of times, and it's been the worst of times. We've grown, we've developed, learned, and been tested like no time before. But we've come out stronger, more confident, more resilient, and more crucial to the success of our organisations and the systems that they operate in. We are set well for the future. I know that you're tired, that the marathon that we were promised now feels more like a long distance endurance race. But I know that you are passionate about the patients and the service users that we serve, and you know just what an incredible difference we can make. So I say, bring it on. We've got this. In closing, I just want to say thank you once again for all that you have done, all that you are doing, and all that you will do. Just keep on being your brilliant selves. One of the great things about having a conference in December is it means that I can be the first one to wish you all a very, very happy and certainly a well-earned Christmas. Thank you very much for joining us today. I'm looking forward to spending the time with you. Thank you. I think we're just waiting for Annesley to come and join us. Please do continue to use that chat room if you can. It'd be great to hear from you.
Here I am. Sorry about that. We'll get used to these slight delays as day goes on. Dean, thank you so much. Thank you for giving us the opportunity to just reflect on what so many people have achieved in the last 18 months. And I think as you started to list them, I really got a bit of a lump in my throat, because it really reminds you what we have managed to deliver. But also thank you for setting out just briefly the challenges, and I think we look to those with some trepidation, but also the opportunities that our profession has to go forwards, making this difference and really sort of driving the national agenda forwards and really having impact. So thank you so much.
Yeah, thank you, Annesley. It is a real difficult balance, isn't it, to recognise just what a tough 2 years it's been, to know that we've got stuff ahead. But I think that inner strength, that resilience that we've developed, the learning that we've got over the last year really does set us well. You know, we will come through this. You know, there will be a return to getting back to that delivery of services that we so want to do. And I think that what we've learned during this time will mean that we'll do that better in a higher profile way, I think, for the profession. We've certainly come of age during this time.
Absolutely, absolutely. I don't think we've ever had quite the platform like this, have we?
No, definitely
brilliant.
not.
Thank you. And you asked in the chat box, you asked us to put in or volunteer the information of how many of us have been around a while. I was easily beaten. I said I'm coming up for 25 years. We've got 35 years, 26 years, 19 years, a mere baby there. But there's a few of us who've been around quite a while and seen many comings and goings, but remained agile, I think. And I think that was a keynote of one of your keynote points as well, how agile we've been, how flexible we've been. I just wanted to highlight.
Annesley, I was going to say, for those that are newer and fresher in, I just want to say for those of us that have been around longer, just what a fantastic career HR in the NHS is. Constantly changing, constantly able to add value, and working with fantastic people. So I know that in these conferences we do get people that are new, starting out their careers, and just that really warm welcome to the profession, to the HPMA, and just wishing you fantastic careers. It really has been brilliant.
Yeah, absolutely. And I think, I'm one of many people who have been developed by the NHS and are ever grateful for the investment in me and the ability to use transferability of skills and have that recognised. So absolutely a great place to start your career and continue your career.
Definitely.
Okay, fantastic. I just wanted to highlight as well, you also mentioned that throughout this, exceptional time, the HPMA has kept going, delivering fantastic events, interactive experiences, and that's a real credit to everybody involved and the participants, that as well as this massive agenda to deliver, people have also taken the time to keep developing themselves, to network and to share information and best practice. So that's fantastic as well. Okay, right. Well, thank you so much, Dean. Really appreciate you opening our conference today, and we'll hear much more from you later throughout the day and into tomorrow as well. So it's great to have you open us in such a invigorating way. Really appreciate that.
Thank you.